big picture is that addiction, whether it be to alcohol or to illicit substance, is always associated with something missing for a person, either psychologically or spiritually. And when I talk of psychologically, I'm talking about how people think, feel, and behave. And when I'm talking spiritually, I'm talking about that sense of being right within oneself and also values. Am I right with myself with respect to my honesty, my integrity? Do I feel good about myself? Do I feel at home in the world? So, addiction is the symptom of a problem. It can become a problem in itself, but it often is a symptom of mental health issues. So, when you go to a treatment program, is the goal only narrowly to just stop drinking? In a maladaptive way, is the goal to stop using illicit substances? I think that it's much more to it, because for many people who have problems with addiction, the alcohol and the illicit substance were the solution to a problem. But that solution became a problem in itself. I know of individuals, having counseled individuals, who said that the problem wasn't the alcohol or the drugs. The problem was when people didn't have the alcohol and the drugs. Because at that point, what are you left with? Left with restlessness, irritability, and discontent. I think the lack and the opposite of addiction is connection. Mm-hmm. When people are we all as human beings have variability of emotions. Sometimes we have better days than others. But it's pretty common for individuals who have problems with alcohol addiction, where it becomes progressively problematic and interferes with people's relationships or work. These individuals are in a state of being restless, irritable, and discontent. What's it like to live inside that? It's very uncomfortable. Well, how do they satisfy that? Get some kind of quick fix to feel good. So we realized that to determine the effectiveness of a treatment program, we can't just look at whether or not people are stopping using drugs or alcohol. We have to look at, are they getting better mentally, spiritually, psychologically, emotionally? And so we realized that what was important was to tap and look at items that were relevant to mental health and well-being. And what I think as a psychologist is particularly important is to be able to gather that information in a way that's meaningful and in a standardized way, a scientific way. If someone, Bob, as an example, or Mary, these are hypothetical names, people who go into a treatment program, and you want to determine if the program was effective, you can ask Mary, or you can ask Bob, you can ask any of the individuals. And that's good qualitative information. But when people talk about empirically based proof that a treatment program is working, what has to happen is to have what's referred to as a standardized process. Some people use the term objective. What that means, from a practical, concrete term, is that everyone is given a measure, the same measure, of that taps into mental health and well-being before and after treatment, so that you can see whether or not this quantitative information, which can be analyzed statistically, whether or not the treatment program has been effective by chance alone, or there's a real effect. One more point I'd like to make about this is that individuals who are coming into treatment are often at a very low point in their life. They've hit a bottom. and people have different kind of bottoms. For some people, it's jail. For some people, it's a loss of a relationship, losing a marriage, losing a home. For some people, it's this element that they're sick and tired of being sick and tired. For some people, they're experiencing chronic anger. Everybody has a different bottom. But there's certainly enough of those individuals who are coming to treatment when they seek out inpatient rehabilitation treatment programs that they've gotten to a point where they're obsessing, constantly thinking about, obsessing the preoccupation with getting the drug or the alcohol. They're in a state of distress. And so we realized that those individuals, when they're first coming into the treatment program, their attention is a bit compromised. They can't sustain concentration and attention and focus for any prolonged periods of time. So it's important to develop an inventory that allows people to be able to complete it within a very short period of time frame. In this case here, the rehabilitation wellness inventory can be completed within 10 minutes. And the information that we gather, which is again related to mental health and well-being, is gathered in a way that can be analyzed using descriptive and inferential statistics, and so that we're able to analyze whether the treatment program is working and stratify whether it's differentially better for men, women, or different age groups. And what I get really excited about is that this process, which is automated and provides a report in real time, is particularly valuable for the therapist who is going to be counseling these individuals. And this information helps to structure the treatment planning process at the very outset, and also is extremely useful as part of the discharge process, where they're looking at what worked in the program, what didn't work. You indicated on this inventory that you strongly agreed that you were sad at the beginning of the program, and now you're disagreeing. That you tell us a little bit more what the transition was, any particular component of the program that was helpful. So the rehabilitation wellness inventory is an extremely useful tool because ease of administration for the individual. It's able to be administered within 10 minutes, 10 to 15 minutes, and the information that's gathered is very targeted and helpful for the treatment professional for treatment planning and discharge. And as someone who is interested in science and looking at evaluation rigorously, and if people are going to use that we are empirically based, then the information does need to be analyzed using proper statistical methods, with gathering information pre and post, and doing the proper analysis. That's the foundation of science, and being honest with respect to, is our program really working?